Mr. Fisher, my name is Shawnee Cuthbert. I'm a student nurse at Cedar Crest College. I'm here to change your dressing, empty your wound, and check on your leg, rewrap your leg. Can I please have your name and birthday? Okay, John Fisher, 615XX. All right, I'm going to provide a little privacy. Mr. Fisher, I'm going to be setting everything up. So this may take a second, so please be patient with me. Let me turn my back on you. How's your pain level? I know they gave you some pain meds about a half hour ago. Are they kicking in? All right, good. The change may hurt a little bit, but it'll be a lot more tolerable with pain meds on board. Okay, do you have any questions with any of the procedures we're going to do? Okay, good. All right, I'm going to start setting up, Mr. Fisher, so again, if you can just give me a moment to get everything in order. I'm just going to put everything out first so I can work and don't forget anything. Tons of extras. All right, Mr. Fisher, I'm going to bring you up to my level, which is pretty high because I'm pretty tall. Okay. Make it easier for me to work with, which makes it better for you. All right, I'm going to do it. All right. Comfortable? Good. Make sure that's yours. Okay, first I'm going to set out some tape, Mr. Fisher, because we need a lot of tape for all of this. We need 4 for your wound, 2 for your drain, 2 for your leg bandage, and 1 to close the wrapping, and 1 to close the ace bandage. All right, Mr. Fisher, I'll leave that out just in case I forgot one, because it's definitely not unheard of for me to forget something like that. I'm also going to initial and date and time 3 of these, 1 for each wound. Okay. Mr. Fisher. This is set, this is set. All right, Mr. Fisher, let me start moving everything over to you. Bring it all to you. Okay, I'm going to be putting on some protective gear, and this prevents me from infecting your wound, which is the last thing I want to do. Okay. My glasses keep fogging up, but I can still see. All right, Mr. Fisher, I'm going to expose your wound now. How is that, let me get this set up while I'm here. How is that bandage? Is it wrapped too tight for you? Just about right? I'll try to get it right myself when I do it. All right, Mr. Fisher, I'm going to be removing these bandages and trying to be as gentle as I can around your wound and on your skin. Okay, Mr. Fisher, you have some Sears Sanguis liquid on the dressing, which is notable and it's common, and that's what we expect to see. There's my flopping gown because I couldn't tie it back. The inside of the wound looks meaty and velvety, which is what we expect to see when it's healing correctly, so everything looks pretty good. All right, let me change my gloves, and then I'm going to irrigate the wound and measure it. All right. You know what? Let me measure it first. And then when I irrigate it, it'll be clean. Part always gets me, Mr. Fisher. As long as I don't contaminate you, everything is fine. Okay. Here we go. All right, that's approximately 5 inches long, 2 inches, an inch and a half wide, and about an inch and a half deep. Okay, Mr. Fisher, I'll note that in the in my note, nurse's note. All right, now I'm going to set up to irrigate, and then we're going to take a culture. All right, we got some normal saline, free of floaties, not expired. Lip it, pour it. Done with that. Now we need wet ones to clean. It's one for the right side of your wound. This is a wet to dry dressing, so we're going to need a couple to wet in there, just like the one you had last time. One for the left, one for the right. One for the packet inside. Two to pack it inside. I'm just going to do 1 or 2 extra just to make sure nothing bad happens. And by that I mean me dropping something, which is not probable but possible. Okay, Mr. Fisher. I also need 2 to dry. And I need 2 to cover. Don't. Mr. Fisher. This is also sterile, so I'm going to need my sterile gloves to touch the stuff that's on the inside, but this is all still sterile, so we're good. All right, Mr. Fisher. I'm going to pull up. out the drain. I'm gonna start from top to bottom until this runs clear. There you go, this caught in here nicely. Now this gets emptied in the, whatever, the toilet, and we can get rid of both of these. All right, Mr. Fisher, you're still with me here? All right. Now I'm gonna take a culture. And I'm just gonna roll it in like a zigzag. Okay, now touch the sides. There you go, Mr. Fisher. And once more time, can you tell me name and birth date? Okay, perfectly. I'm gonna label this and send this out to be tested. All right, Mr. Fisher. What I just did. Let me change my gloves and set up my sterile. Ooh. Hands get hot in there. Nope, nope, nope. All right, Mr. Fisher. These things can get a little hard to use, but I brought backups.
I can't see you, Shawnee.
See, Mr. Fisher? Good old sterile gloves, never fail to fail you. Okay. Now, what I'm gonna do is I'm gonna clean your wound down to the right. Your right. Down to the left. Again, your left. All right. What the heck, Mr. Fisher? All right, now I'm gonna bunch up a couple of these, get them all fluffy. Get them inside your wound. Okay. Now, Mr. Fisher. Oh, I have so many extra. We're just gonna drop these on top. Top. Sterile part is already done because that is covered. So I can try to open this one. Just let it open. Cover the drain. Okay, Mr. Fisher. You know what? I'm only going to be touching the outside of a combine, so. Inside is sterile, the outside is not. All right, Mr. one has my name and initials on it. Time and date. I should say initials, time and date. And this one, actually this one has my initials, time and date. And the rest is for your leg. Okay, I'm gonna close this back up for you, Mr. Fisher. Please let me know if it's too tight. Because we don't want it to be tight, it can cause more damage, but we need it tight enough to hold it. All right. Well, I'm here. Try it. Okay. You're gonna empty your, I don't anticipate it spilling, but I have another cloth here, another catch basin just in case. Okay. Clean that all off. Squeeze it. Close it. All right, Mr. Fisher, there's approximately 30 milliliters of some pinkish fluid draining, which is good, what to be expected. We'll flush that and throw that out. All right, Mr. Fisher, let me get this all done. Put that down. Throw out these. All right, go with me so far? All right. I'm gonna change my gloves. As your hands get all wet, and then it's chaos. All right, Mr. Fisher, removing your old bandages. This should be on your fluffy, which it is. Oh, patch. All right, well, you must have had this done a while ago, Mr. Fisher, because I don't see any real problems here whatsoever. It looks like it's almost completely healed. I'm going to put another combine. This one has my initials. So that goes on there nicely. And then this one goes on. And now we're going to wrap it nice and fluffy, not too tight, to give it more protection and padding. Not too tight, feels good. Okay, Mr. Fisher. That is done. And now I just got to put the ace bandage on. You, sir, are done. Come on, sir. Last piece of tape. Okay, Mr. Fisher, you are officially done. I'm going to lever the bed, go outside and make a note of everything I did. And then I'll come back and check on you. Here's the call bell. Thank you. Forgot to dry it.